Our goal is to guarantee health care as a human right for all Californians, advancing the larger fight for healthcare justice and energizing the implementation of national single-payer Medicare for all. And now Maureen will introduce herself and other board members.
Hello, everyone. Thanks so much for coming here tonight. So I just want our board members to say hello to you. First of all is Gina Viola. Gina, can you wave? That's Gina. She's one of our co-chairs. Erica Ferriston is the other co-chair of Healthcare for Us. And Carol, who just spoke to you, she's one of our outreach and communications coordinator. We have Cheng Sim Lim, who does outreach and political work. We have James Sarentinos, who is our recording secretary. We have Paul Newman. Paul, say hello, who handles our Zooms and some of our tech. And then we have our wonderful treasurer, Scott Viola, who takes care of the money, but he also does a lot of tech work for us. So that is our current board, and we all welcome you. And tonight, we have a special guest who is a relatively new member of Healthcare for Us, and that is Tim Horner, who has a very compelling story to tell us. Can you wave? Say hi, Tim. Tim, there's Tim. And Tim is going to tell us all about his situation and why he is advocating for CalCare, single-payer universal healthcare in California. So take it away, Tim.
All right.
You're a big guy.
All right. We had multiple Zooms going on in the same room. Got to figure it out.
You have a killer guy mustache.
Hi, everybody. Yeah, my name's Tim Horner. I was really honored when Erica asked me to give my personal statement about why I'm drawn to this work. I have an unusual lighting situation. I have an unusual story. When I was 18 years old, I broke my neck in an unusual kind of freak accident and was paralyzed and told by the doctors that I would never move again, that I had about a 1 in my leg. I was told that I had about a 1 in 100,000 chance of ever moving any muscle again from the neck down. And obviously, I recovered to at least some extent. It was lucky in many ways that I did. One of the ways is that had I needed another month or so in the hospital, I was in the hospital for about 4 months. Had I needed a few more weeks in the hospital, had I not just experienced a sort of miraculous recovery, I would have reached my lifetime limit on my parents' insurance policy, and my whole family would have been bankrupted by medical bills. However, I was unbelievably fortunate enough to recover and to be able to walk again and move again. Cut to many years later, I am now an actor. I've made my living as an actor here in LA for the last 20 or so years. The first 10 or so, I didn't have any insurance at all until I had gotten successful enough to qualify for insurance through the union. However, in the course of the last 8 or so years, I've been having a lot more problems as a result of my injury. I've been dealing with a lot more chronic pain. I have high muscle tone problems in my extremities, which have resulted in some foot surgeries that have been real painful and difficult to recover from. I have now for about 8 years been in constant physical therapy. And as a result, I'm kind of stuck in this crazy catch-22. I qualify for insurance through my union based on how much I work. I have to work enough and earn enough to qualify for insurance through my union. I need to be able to move. Well, to work as an actor, I need to have the physical capacity to inhabit a character, to move around a set or a stage, and then to if I, but to move well, I need to have access to physical therapy and access to medical care. So if I lose insurance, I will lose my access to physical therapy, which will keep me from being able to work enough to get insurance again. And it's not just insurance for me, it is the insurance that my entire family is on, my wife and 2 young sons. My wife owns her own business and can't afford to have insurance as part of it. So we're all under my my health insurance. So as I age, it is going to be increasingly difficult. Movement for me is going to be increasingly difficult and painful. It is going to be increasingly difficult for me to continue working enough to qualify for health insurance. And I don't want my sons needing to get a job at 14 so that they can help pay for our health insurance. Universal health care would remove this as a stress from my life and from the life of my family, financial and otherwise. So that's personally why it's so important to me to be throwing my shoulder into this work. It's also just, it would just be such a profoundly impactful thing for our entire community. When I think about how it would affect the lives of our unhoused neighbors, when I think about how it would affect the lives of people wanting to, like my wife, wanting to start their own businesses, people that would want to leave a job that they are only in because of their health insurance policies, for people that it would be great for the economy. It would be, as far as people starting businesses and for small businesses, it would be great for unions. I just was on strike for the bulk of the last year with my union. And if my union wasn't having to negotiate healthcare plans with their employer, with the producers, how much easier would that be? So I just think it would be more than almost any other policy. I think it would be a democratizing force in our state, and would be a really impactful and important thing to do. So aside from my own personal stresses about it and my family's stresses about it, I just feel like it's the most important thing policy wise that we could do in our community to really, really change things for the better in a community that's just so obviously struggling and suffering in so many ways these last few years. I've seen personally, my younger sister is fighting colon cancer and was denied treatments. My best friend had a son with childhood leukemia that he fought for 10 years. And oftentimes I would go to the hospital to sit with the kid during his chemo treatments because his parents needed that time to be dealing with health insurance phone calls. We all, I'm sure, have examples of how obscene the current system is and how much it takes from suffering people. Just the notion that they profit off of human suffering is offensive to me. And so that's why I think it's important. That's why I'm committed to this work, and really excited to help out in these next 6 months of really important time.
Thank you so much, Tim, for being here tonight and sharing your story. For those of you who don't know me, I'm Erica Ferriston, and I'm chair of Healthcare for Us. And I know that, Tim, you can stay with us for a little bit, but you do have a call tomorrow, so for a job. So we really appreciate you being here. I know we are all on Zoom. Ugh, Tim, you choke me up every time. I know we are all on Zoom and we were all on mute, but even my heater went silent when you were telling your story. I feel that everything silent as you told your story. And tonight, this meeting is really focusing on the practical next steps, to-dos, getting us hooked up with our CalCare district leader representatives, so that we can have our meetings with our assembly members. But it's also about how to tell our personal CalCare story when we are in those meetings. And so Tim was, an example of how to share your story. And I think my district, I have Assemblywoman Jackie Irwin and CNA Representative Ryan Skolnick has history with her. He used to be a delegate in her district. And he said, first of all, she is so not with us, but we're going to meet with her anyway. He said she fancies herself as a budget hawk, that she fancies herself as the adult in the room, and she absolutely does not care about any emotional reasons of why we should do something. But I would bet money if you told that story, you would even move her. So thank you for being here tonight. Thank you for going first to share your story as an example, how we can share our stories as an effective way to not just move our legislators, but anybody you're talking to. And later on, we're going to have breakout rooms to practice our story sharing. So with that, Changsim, did you want to introduce Yvette, or did you want me to just keep going?
No, please keep going.
Okay, so I'm going to drop, I just dropped an agenda in the chat. It's a pretty basic agenda. And so next we have Yvette Floras from CNA. She is taking over for Ryan Skolnick while he is out of town right now. And Yvette is new to CNA. I've had many opportunities to connect with Yvette, so she's a great addition to the CNA team. And I know some of you have been on meetings with her as well. But with that, I'm going to pass it over to Yvette.
Thank you so much, Erica. And thank you so much for sharing your story, Timothy. That was really incredibly powerful. And Erica's completely right. Those types of stories are what ultimately moves people to action. I am so excited to be here covering for Ryan while he's out for the next couple weeks. And Erica has been wonderful to work with. Today, what we've decided is probably the best way forward is to give y'all a little bit of an overview of what's going on with the campaign. What district leaders are, what the legislative session is going to look like because it just started, and how you can plug in. So with that said, I'm going to go ahead and share my screen. I have some slides here to help me out. So the first thing I do want to cover with y'all is what district leaders are. So district leaders are the heart of the movement. They are folks who have taken it upon themselves to be the point person, to be the organizer on the ground, the volunteer organizer for the CalCare campaign. And what we do as staff is we support district leaders by holding meetings, by organizing actions that ultimately enable other people to learn about CalCare and then plug themselves into the CalCare movement. And so district leaders have been working very hard throughout the 3 phases of our campaign. The first phase was, of course, canvassing to build power. The second phase was creating really wonderful organizing committees who then power mapped the district and then proceeded to reach out to local groups and organizations. And then now we're moving into phase 3, which is probably the most fun part of it all, which is wielding the power we've built in phase 1 and phase 2. And so what is phase 3? Phase 3 is revolving around the legislative session. So right here, you have some important dates on the screen. January 3rd was when the legislature just reconvened. January 19th is the last day to submit bill requests for Leg Council. February 16th, last day for bills to be introduced. And then you'll see some important dates regarding the Health and Appropriations Committee, which the CalCare bill must make it pass in order to get to a floor vote on May 24th. And so because the legislation has started, the legislative session, we want to make sure that we're having some FaceTime with these representatives to assure that they understand what they're going to have the power to vote on when it comes down to the floor vote of the Health and Appropriations Committees and the floor vote in the Assembly. And so that's where legislative visits come into play. So we are holding legislative visits in each assembly district between January 9th and February 22nd. What are the goals of these legislative visits? So the goals are to notify legislature that CalCare is being introduced. Second, ask for their support. Third, identify any questions/concerns to further follow up. Fourth, if the member is supportive, we then want to ask them to sign the CalCare pledge. These legislative visits are not meant for policy experts. We're not expecting you to know every single little detail of the CalCare bill. These are a great opportunity to first gauge where your legislator is at, and then share some really impactful stories like the story that Timothy shared tonight. And that's what these, wonderful legislative visits are meant for. Now, how do you get plugged into the campaign, right? How are you a part of these legislative visits? So the first thing is you want to find your assembly district. Again, like the title says, district leaders referred to leaders within each assembly district. The goal is to have as many district leaders as possible in every single assembly district. So you want to know your assembly district first. Then you're actually going to insert your phone number, your email in this chat right here in this Zoom. And then we're going to go ahead and we're going to connect you with your district leader. District leaders are all over California, so it doesn't matter where you're at. If there is a district leader, we will connect you via email so you can get plugged into those legislative visits. And if there isn't a district leader, or if you want to become a district leader yourself, because we always need more, you can feel free, to tell us that when we reach out to you. But that is a very quick 5-minute summary of where we're at, where we have been, and how to get plugged into the campaign. So with that said, everybody who is ready in the chat to go ahead and get plugged in, please go ahead and put your phone number or your email. You can also DM it to me, and I'll give you guys a couple of minutes to go ahead and do that. Let's see who's going to be our first person. Nice. Okay, I love it, Alex. Wonderful. We'll go ahead and we'll connect you.
I just threw into the chat. This is Gina. Hi, Yvette. Thank you so much for that presentation. I've been connected with my district group now for about 5 months, I think. We've been connected as a team. And, it goes from periods of being quiet, which I don't think are going to happen now moving forward. But, these are a group of people who are as committed as we all are to doing stuff. So we really are sharing the work. And hopefully all able to show up when we do get that legislative visit, so the assembly member can see the power of the group that's behind it.
Exactly right, Gina. So I see a ton of people in the chat putting their information in. Feel free to go ahead and let us know, reach out to us. I'm going to put a couple of resources in the chat for y'all. I'm going to put my phone number, I'm going to put my email, our general info at email. And if you feel like you want to become a district leader, I'll also put that link to sign up to become a district leader in your area as well. I think we have a couple minutes left over for questions if I'm looking at my clock right. Erica, is that right?
Yes, you're good.
Yes, we sure
Okay,
do.
nice. Okay, so I think we have time for like 2 questions. So if anyone has a question they would like answered, please let me know.
Go ahead, Alex.
Hi, I'm Alex and Tim's wife. My question is it helpful for us to go with people in their districts outside of our own, or just to go to our district's legislative meetings?
That's a really great question. So it depends on where your legislator is at, right? So if your legislator is a Republican, right? and there's no way that they're going to support you. But right next door, right, a couple streets over, there is another assembly district, and there's a better opportunity or a better shot to get that person to sign on to CalCare. You can, of course, choose to go down that route and work on that district instead. But if you can, and it makes sense, we always recommend to go and lobby your assembly member, because ultimately they're your representative, that you're their constituent, and that connection there is really great when you're trying to lobby someone to sign on to a bill. That's a great question. And then
And
Paul,
then
I
can
see your
I
hand up.
add on to that before we go to Paul, Yvette? Yeah, also too, Alex, if somebody happens to have a relationship with an assembly member who's not in their district, that would be great. If there's already, like, Gina is in 8051 and there's already a huge group working on Zabur. So if that was the case, and then there was a district where there wasn't anybody, then that would be great to hit another district. So yeah, I just wanted to add in those couple other things also. So tonight, so while everybody's putting in their information, what Yvette is doing is she's collecting that, and she's going to contact everyone in the next couple of days. She's going to look, and if you don't know your assembly member, she's going to find that out. She's going to look and see, okay, who is that district leader? And she's going to directly connect you to your district leader. If there isn't a district leader, she might hit you back up to encourage you to become one. So yeah, putting your name and your contact information in the chat. If you know your AD, great. If you don't, I did drop a link. Please do that, because this is kind of the working part of the meeting right now. And then I will be quiet because I see Paul has his hand raised.
I, of course, have a quick question, and that is, I have in the past visited assemblymen, senators, and so forth, but usually they send somebody else except themselves. In most cases, will we encounter that, or will we be able to actually speak to the actual assemblyman or senator?
That's a great question. So it's going to depend, again, district by district, if that assembly member is going to want to meet with you independently, or if they're going to want their staff to meet with you instead. What I will say is that I guess the larger the amount of pressure there is on the legislative session or on the legislative visit, ultimately the higher chance there is that you're going to meet directly with the assembly member. But ultimately, it comes down to the assembly member and what their choice is. It's a great question, Paul.
Thank you.
Great. So with that, thank you so much. And thank you, Erica, for the invitation to come and speak. And I will put a bunch of really great resources in the chat for y'all, and then expect to hear from me in the next couple days, either through phone number or through email. And some of you might even get a connection immediately from me, a connection email with your district leader. But yeah, it's wonderful to be here. Wonderful to meet all of you, and have a great rest of your meeting, everybody.
Thank you so much, Yvette. So happy you're here. And then also, just so everybody knows, there will be a CNA representative in each district meeting. So if you are a district leader, you won't be there alone. So yeah. Okay, with that, I think it's time for Gina.
Hi all, good evening. My name is Gina. I use she, her pronouns. I was going to say I'm with White People for Black Lives, but I'm with Healthcare for Us tonight. Habits. Thank you for that, Yvette. That was so helpful, and exactly what we're going to be doing at the nurse's behest, in line with how they want us to operate. But in addition at Healthcare for Us, we're going to do some more pressure things. We're going to do some more digging on our assembly members. We're going to, potentially show up at their doorstep. We're going to be making some additional calls. Erica and I were on the phone the other night, and I had the idea to go post up, paste some CalCare signs outside all of the assembly district offices, so the assembly members will see the CalCare signage. And part of the way we're going to do this is by creating a rapid response thread. So for those of you who are in the activism world, and I know several on this call already are, we use an application called Signal. And it's end-to-end encrypted and a much more secure way for us to chat in groups, as secure as anything can be these days. Anyway, so one of the things we're looking for, we do have a really short period of time to get this bill moved. And what we've heard from more than one source at this point is that when this bill lands on the governor's desk, he will have no political choice but to sign it. So this is really exciting and it's really motivating. And I'm sure it is for him too, which means he's going to do everything he can to kill it before it gets to his desk. So that's why I'm suggesting there are going to be some alternative direct actions that we're going to be taking to make sure that folks don't just line up, behind what Gavin Newsom wants. That folks are, the assembly members and then the Senate are going to feel the pressure of their constituents and the people and what we want. And what we want is CalCare, right? We want CalCare in its whole form. We don't want an amendment. We don't want a loophole for insurance companies. We want to abolish insurance companies and implement the true single payer bill for California, which is CalCare. So this rapid response thread is a little different for many of you are on our action channel. We're probably going to rename that information because right now that is what we do with that channel. We share a lot of information with one another. This rapid response thread is going to be different. It is going to be, hey, listen, we have an opportunity to show up in numbers at this legislator's office tomorrow. Can you do it? We want folks to join this thread who will read everything that's posted and make every effort you can to be able to respond to it. So for someone like myself, I don't even know how many threads I'm on. I'm going to guess 30, I'm actively reading probably 20 of those every day. So I know how difficult it is to respond. So this is going to be an invitation. And I hope Eric is going to drop the link in the chat for the invitation to join the Signal thread. And then we have to accept the invitation because we are going to vet people. Since we are going to be doing direct action on this thread, we want trusted folks on this thread. But moreover than that, we really do want folks who can make an effort to respond to this. Okay, so we don't expect you to show up to every single thing every time it's posted, but we do expect that you're reading it and making an effort to do that. And so one of the things I have said, and I've said to my partners at, Black Lives Matter Los Angeles, where, I'm a Solidarity member there, I've said to leaders there, look, CalCare is going to be what's coming first for this year. And once we get that on the governor's desk, I'm back to being BLMLA will be number one again. But that's how important this is to me. So I am willing to go to the end of the earth, and we are looking for folks who are feeling just as moved as, as Tim is and Tim's family, how important this is for Tim's family, that he not have to stay, maybe painfully working a job to qualify for what is probably some of the best insurance that you can get in LA, right? Screen Actors Guild is one of those good plans. So it's really hard for them to give it up, and give it up because you're going to get something better with CalCare, significantly better. So thank you all. I really hope you'll consider, diving in on that rapid response thread with us. And we're going to make those things fun. I promise. We don't do boring direct action. We're going to laugh. It's going to be a little edgy, but it's, we're going to be heard and we're going to be seen, and they can't ignore us. So thank you, everyone.
And I see Michael Hobson's question, and I'm just going to open it up for anybody who knows the answer. Is there anyone in the state assembly in the LA area up for re-election? I think that qualifies Michael as already being in the rapid response chat, because I think he's plotting.
Yeah, I just wanted to quickly hop on and I asked because, and I did join the rapid response team, and I wanted to ask that question because, it's just how do we use leverage against these motherfuckers? Like, because that's all they truly care about. Many of them is maintaining power, and if we are if we tell them we are not going to vote for you, if you don't vote for them, that is leverage.
So,
And just this week, oh, sorry, Erica. Just this week, I'm like combing through every assembly members on the health committee's donations. So I'm
Oh, okay.
finding where they're, where
Love
they're
it.
getting all their money from. And we're going to start making some of that public and make some public noise about it to put pressure on them. So stuff like that, you're right, Michael. That's where we're going. That's where we're headed.
and we've seen the success of that with Black Lives Matter, obviously, which Michael, you are a part of, but sharing for everyone else in the group. So, Jackie Lacey, she's gone. And that was because of consistent, sustained action led by Black Lives Matter. Eric Garcetti, he was in line to have an appointed position from President Biden. That did not happen because of the consistent, sustained action that Black Lives Matter led. And so what we're learning in this movement,
Ooh, Sheila put in the chat, Villanueva did not get reelected.
Villanueva,
Guess
basically
who
what we're learning
led
is
that charge?
Yeah, I was gonna say what we're learning is Black Lives Matter is badass, and so but yeah, so we think that it's that is going to break through their money, which we obviously can't match. Because if you think about it, I know there's been a lot of talk, about some people in the legislature that have basically co-opted the movement, and it seems like they've got strong, powerful ties politically. They've got a lot of money, but we're seeing that losing street cred and doing things that really show people who they really are publicly. Like I said, that happened with Eric Garcetti. I mean, talk about connected to power. He was connected to Biden. He didn't get that appointment. So I think y'all get my point. I'll stop talking now. Thank you. Okay, so Gina, I'm going to turn it back over to you about, because we're going to open up the breakout rooms and do our story practice time, but I'm going to let you set that up.
Great. Thanks. So yeah, what we're going to do now is we're going to go into smaller breakout rooms so that y'all have a chance to listen to the main room. Thanks everybody. And thank you for getting vulnerable with us and each other. The more we can get used to telling these stories in front of folks we know, the easier it'll get telling these stories in front of folks we don't know. So, but it is hard to do, and it can, even hearing other people's stories, like I really do feel very deeply impacted by it. So please do what you need to do to take care of yourself tonight and be kind and patient to yourself tonight. And I am wondering if there's anyone here who wants to share about what's exciting them about what's to come in the next 6 months. If anybody had a really impactful situation in the breakout room, or just excited to hear about our rapid response thread or being paired with your district leader, now's the time to tell us.
I'll go. Can I just talk? Okay. Yeah. Well, we heard a really powerful story, and I have problems with those because my story is kind of an unstory, and so it's kind of not all that cool. But that was really powerful. And also, as far as the rapid response thing, I don't live in the greater LA area, so I don't think I'd be joining only because of that, because I live so far away. But yeah, we did that. But that gets me excited, because I'm just excited about meeting with our assembly member and having that little sit down with him. Yeah.
Thank you so much, Vicky. I love that you're excited about something you're not even going to join. It gives me more excitement to get the rapid response
I'm,
thread
I'm
going.
sorry, I just don't live near there. So, I mean, they're like, go
No,
do this. And I'm like,
completely understandable.
yeah, it's kind of dumb. Yeah.
But know that we'll be out there wheat pasting for you. I said I was going to use my staple gun, but I think I have to wheat paste. Go ahead, Carol.
Yeah, would the rapid response channel be used for possibly for like phone calls to assembly members?
It could, if that's what we decide, like everybody has to drop everything and make these calls to assembly members today. Absolutely.
So that
It
might
won't
be
just be in-person stuff.
a reason for people outside of LA to join the channel.
Yes. Yes. Thank you for pointing that out, Carol, because
Sure.
you're right. And Zoom meetings too. It could be about Zoom meetings as well. Go ahead, Taichi.
Sheila had some great suggestions. I don't know how we can follow through with this. Hopefully we meet more academics, but trying to do gathering of more demographic data in all of the districts before we meet with these assembly people, such as how many nurses are living in their district, you know, how many Black people live in the district, things like that, you know, just to bring more that sort of information to them to hopefully motivate them to get behind CalCare.
Yeah, that was great. She also recommended like how many uninsured are in their district, how many unhoused are in their district. That's what I was like, we need some data, folks, because that's a really good idea. And I think that UCLA has done some of that data. Thank you, Taiji.
Yeah, thank you, Taiji. Thank you, Sheila. And on Monday's show, for anybody who missed it, you can listen to it in the archives. You know, a suggestion Mike Bonin had is said, find out how many nurses are in the district, and let them know that when you're in the meeting.
Yeah, that's what sort of spurred. That's what got my wheels turning.
Oh my God, you listened. All right, Gina, I'm turning it back over to your facilitation. And while you're doing that, I'm just going to drop in the chat. If you haven't already signed the CalCare petition, I've just dropped it. Probably most of you here have. But anyway, Gina, continue, please.
Hi, Alex.
Yeah, there are two reasons I'm excited about it being now. One is, as Gina and Erica know, we've been doing a living room series with girlfriends to help educate. And one of the two issues that were chosen as the top was healthcare. So I just learned a ton over the last 3 months. I didn't know, and Erica came and spoke, and then we all did our own research, and I'm on fire about what we've learned. It's outrageous. And the second reason, again, to points that were made earlier about BLM's work, both, you know, with Jackie Lacey and Chief Beck, but for me personally, the People's Budget LA has taught me the importance of organizing over time and then knowing when you could really make a change and the power of that. And for this year, where it's an election year, I feel like all these people being up for re-election, we have the attention of the public in ways we don't in other years. I've just seen people go back to sleep anytime there wasn't a constant news cycle about elections. And it feels like this is actually a time where not only could we pressure the electeds or the people that are running for re-election, but also where people who sat on the sidelines, we could say, hey, there's this chance. And if we get it passed by June, imagine how that impacts the national conversation in other states and federally.
Yes.
Into the summer, it feels wildly powerful.
Thank you, Alex. Go ahead, Chung Sim, and then after Chung Sim, Michael.
This is in response to what Sheila said. I just put into the chat a link to the USC Neighborhood Data for Social Change. That is a very, very, very useful database. You can really drill down like to the precinct level, like finding out demographic info, like immigrant population in the district, And you can, and it's mainly, unfortunately, it's mainly for the LA metropolitan area, LA County. So it, I think, doesn't include stuff outside of LA County, but for LA County, it's incredibly helpful. Even longevity rates,
Yes.
insured and uninsured populations, yeah, COVID, like incidents, all that kind of stuff. We used it a lot when we were meeting with the LA County Board of Supervisors, and some of their staff were really shocked that we knew, like, down to the street, like, this street in this part of your district, there is blah 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 blah. They were like, what? Like, how well we knew the district. So yeah, it's
Great work. Great work.
link is in the
Yeah.
chat.
I just bookmarked it on my browser, so I suggest everybody else do the same. Thank you, Cheng Sim. Michael.
Hey everyone. I guess a couple of things, and just to kind of add of what people have already said, I'm excited because of the momentum that this could create at a national scale. I think about when things pass in California, it gives momentum to other states and federal policy. And I think about the Crown Act, which, banned discrimination of Black hair. That's just one example that was first passed in California. And now I think over 7 states have similar policies. And in our group, we talked about, for me, like, my mom got breast cancer over 10 years ago, and because of her doctor and having healthcare, it literally saved her life. And so that, for me, started the unlearning around, like, the bullshit around private healthcare and how privatized healthcare is literally killing people, as I think a lot of us know. And so, yeah, I'm thankful to be a part of this fight. I'm actually about to start a second job. But this work is just really important to me. It hits home. It hits home for a lot of us. And so, I'm just willing to make time for it. Posting on social media, showing up to direct actions, rolling up to these politicians' houses, visiting their houses. Yeah, it's definitely something I want to make time for amidst my limited time. But yeah, that's all I got for now.
So much, Michael, both for the personal story about your mom and your excitement. I'm gonna sideline with you about that second job. I didn't know. Maureen.
Yeah, and I'll quickly say, I guess I didn't even give more context with my mother. She is now cancer free. She did have a double mastectomy, but she's been cancer free for over 10 years. So, yeah.
I want to share what I'm excited about, and that is that there are so many people on this call who I do not know. And that is really exciting. And I hope I get to know you much better in the coming months, and that we see each other doing the good work that needs to be done.
Absolutely, Maureen. Thank you so much for that. I mean, we could talk all night about it's hard coming out of story times and then not letting everybody share their story again. But we also know that everybody has to get to bed at a reasonable hour, so we'll move along. Go ahead, Cheng Sim.
Yeah, we didn't do intros at the very beginning, since Maureen brought up the fact that there are lots of people that, are new and we don't know each other. Maybe before we go, we can do a quick round of whoever's still remaining. Just really, really quick, like, name, where you're at, and why you're in the CalCare fight.
Sure, we can certainly make time for that. And one of the things Erica and I were willing to do is we were willing to stay on past 8:30 for anyone who had digging questions that they wanted to get answered tonight. But we definitely do want to make an effort to get off at 8:30 and honor everyone's time. I'm starting to feel like Zoom meetings shouldn't be longer than 45 minutes, and I just don't know how we would ever do this meeting in 45 minutes.
Why don't we just quickly go, what our committees are, just really quickly, and then we can hit the quick hellos after that, and then we'll close. We'll quickly adjourn, but then for those who want to have further conversation, we'll stay on. Sound good?
Yep. Erica, can I quickly make that announcement about Monday? Because that's a way that we can all meet one another in person and show up.
So why don't you go
Action.
ahead and talk about your committee role, and you can do that, yeah, at the same time.
Okay, my committee role is making presentations to groups, and we haven't gotten rolling as much as I'd like us to be, but we will. And one of the things people can do is show up Monday at the People's March in solidarity with Gaza and for the people's needs here at home. It's after the Martin Luther King parade. At the end of it, we are meeting at 2. Oh, you can go on our website. Go on our website, hc4us.org, to events. All the information is there. It's 2:00 for a march, and we're going to be there for CalCare, and then 5:00 for a vigil. And that's it.
Yeah, so if you're interested in speaking and giving presentations,
Oh, sorry. Yeah. Yeah, I'm sorry. That's, yeah.
Maureen is your person. Why don't we go to Chang Sim, Actions and Outreach?
Yes, I do outreach. Outreach to me is basically building the base, and we want to build not just a wide base, but also a strong base. So anybody who is a part of another organization, for example, or you're tight with you got your community that you want to bring them into CalCare, talk to me. We are always needing to build our base because it's the only way we can win. Is you need to get more and more people and expand our base and strengthen our base. Taiji here is with API for CalCare, and that's we're work together. API for CalCare. Same thing. We want to anybody who's Spanish speaking. We really need Spanish speaking people. On the outreach committee, where I'm afraid to say short on people who have time to work on outreach who are Spanish speakers. So if you are a Spanish speaker, please come work with us. Thank you.
Thank you. Carol, communications.
My main activity is that I organize and send out the email blasts. And we all wear a lot of different hats. So, that's the main thing I do is the email blasts. And I also wanted to say that I put in the chat another database, which the short name for it is CHIS. And this is from the UCLA Health Policy Center. And it's based on California. And it also looks at different counties in California. Now, there's supposed to be, I don't know if they've done this yet, but they're supposed to be updating. It's called CHIS NE for CHIS neighborhood, which would be similar to what Chang Sim was talking about, where you can drill down to the precinct level. And so I would just suggest going to this website and looking around. It's really easy to access the data. So they have all kinds of questions like about insurance, access to healthcare, dental care. And it's really important to keep following through and going through the questions, because sometimes you'll see a response, it's all data based, which is like, oh, well, that's not that bad. But then when you follow the questions down the line, you realize, oh, wait a minute, these other questions are getting more to the point. So So that might be helpful when you talk to your assembly member.
Thank you. And also, and Carol does many things. She does membership, but in communications, it also includes writing op-eds, letters to the editor, helping us come up with social media tweets, just anything in the, written form. So if that is your thing, if you do graphics, I mean, whatever talents, connect with Carol and then she'll get you to the right place on that. But thank you so much, Carol. Gina, you want to do political?
Well, I'm pretty sure this whole meeting was political. So at this point, it's going to be direct action and scheduling, assembly member visits and data digging to bring with the assembly member visits. But that's, tonight is a snippet of what the political group does. So if that's your passion, join our rapid response thread.
Yes. And speaking of data and research, James and Scott, I don't even know if Scott's still here. Oh, there he is. But they are our main data and research folks. So if that is your thing, reach out to James or Scott. And then of course there's always a need for fundraising. Some of you, I know Michael Hobson was there, came to our comedy fundraiser. Fundraising is led a lot by Paul Newman. So if that's your thing, I'm sure he would love your support and partnership. And Paul, being the great fundraiser, he dropped the put 5 on it donation. So thank you for that. It is 8:44. We went 14 minutes over. Not bad. And so we are adjourned. And if anybody wants to stay on and talk, you're welcome, but the meeting is over. The recording can end.